Good afternoon, all of you. So this is the second webinar for under the Healthcare Insight series, the initiative being taken by Healthcare Sector Skill Council. We are the body under the Ministry of Skill Development and Entrepreneurship for skilling, reskilling, and upskilling opportunities in the healthcare sector. And we are very, very thankful to our renowned speaker, Dr. Dhires Kumar Chowdhury, who is a renowned geriatrician and social activist, and director and CEO of Banchbo Healing Touch Foundation, which is a Niti Aayog enrolled organization. He is also the pioneer of a geriatric home-based healthcare initiative in Eastern India since 2007 and fellow of Geriatric Society of India, executive member of Geriatric Society of India, Eastern Journal, treasurer, Geriatric Society of India. And he has attended many conferences on geriatrics and gerontology, both in national and international platform. There are many stalwarts on his shoulders, and he has received many awards and recognitions across country for outstanding contribution in geriatrics and social activities. I'm very, very thankful to you, sir, and to bring up this very important topic, the integrated and collaborative approach in geriatric care, which is a very important topic, especially in the times when the geriatric population is increasing day by day. We have increased the aging age as well. So, and this is not only the problem area for India, but also across the globe. So we all should know, be it the healthcare professionals or non-healthcare professionals, that how we should give the effective geriatric care. So over to you, sir. Please take it on.
Thanks. Thanks to first of all my gratitude, and it's my honor and privilege that Healthcare Sector Skill Council is a premier organization of the Government of India for accreditation of the different healthcare related courses. Who have given me that great opportunity for this second health series to talk on the second health series. And another one thing important that is for the selection of this mm, uh, very advancing uh, time necessity that topic integrated and collaborative approach in geriatric care, overall the geriatric care. And thanks to entire HSSC team, especially Mrs. Srimati Bhattacharya and Saurabh Goswami of the coordinator of Eastern Northeast, and especially Dr. Meghna, and all other team members for their nice cooperation in this regard. And today, before discussion, there are lots of already participants have participated, and not only individually from the individual link, also in my organization, more than 50 participants participated as a group, and that consists of different age group, not only the healthcare personnel but also the senior members. As I informed, some senior members from Kolkata Police Pronam unit also joined today, and some other senior members from our organization joined today and different organization. So it's my definitely honor and privilege to talk before them about the integrated and collaborative approach in geriatric care. And for thanks for nice introduction of myself and for my organization. And through my organization, Banchbo Healing Touch Foundation, I'm engaged in geriatric care for more than 2 decades, not only academically, but in the field level, not only in the metropolitan city, Kolkata, but in the remote area like Jungle Mahal of West Bengal and the Sundarban. I'm deeply attached with the geriatric field, geriatric care, as a geriatrician and as well as obviously social activities. And through that, my experience, actually, I would like to share some points. Actually, some members who are at present 85 plus 86, they are also participated. So it's not that my guards to advise them because they lost their long life qualitatively and productively. So it's my just sharing of some my experiences to the senior citizen as well as who are engaged or who will be engaged in the geriatric care as a nurse, as a healthcare personnel, as a geriatric caregiver, even the family members, those are related with the geriatric patients, geriatric members in their family. So, before going to that geriatric care, details of geriatric care, I would like to share some very important points. As already mentioned, that it is a global issue. So, aging population is actually global risk, and we all familiar with the last G20 summit, which was held in India, in New Delhi. But in 2019, the G20 summit declared aging population as a global risk. It's not only in our country, not only in the developed or developing country, entire in global population, the global populations are now becoming aging population. So this is the issue of not local or not national, it is an issue of global. So this is very important. And if we compare with that, what are the key features of elderly at present in India? At present, total population of a geriatric population is now 15 crores. Not as per the last census of 2011, because the census is not happening in 2021, but the last data which we found in different sources that now at present 15 crores of elder populations are there. That means 10.5% of the total population is now geriatric age. So what significant amount? 10%. And now 10%, but projected it is nearly 35 crores in 2050. That means it is more than 20% of the population. And as you know, the India is a very what the unity even in the aging aspect also, unity in diversity as well as unity in aging aspect also, because India is a very younger nation, as 65% of the total population of India is under 35. But as well as nearly 10%, which if any country has the more than 7% population of the geriatric age group, then it is called aging country. So as well as India is also aging country. So simultaneously, younger country and aging country. And at present, total 80 plus years aged population, as per in 2020, it is more or less 1.5 crores. 1.5 crores people, 1.328427. That is the actual figure, but in the 2020, obviously now it is increasing. So nearly 1.5 crores people are 80 and beyond. So that is also very significant number. And nearly 8% of our elderly population are completely confined within the bedridden. So, and more than 15 million elderly live alone, and three-fourths of them are women as per the last census. It is as per the last census 2011. And as per the National Sample Survey 75th round, about 70% of the aged persons had to depend on others for their day-to-day maintenance. So these are the key features. And why I am saying these key features? Because to know the elderly population, their status, not only in the health status, their socioeconomical status, and to know about them, we should know what are the now present scenario of elderly in India. So this and there is a no definite plan or goals for the last one third of the lifespan. As now you know, you all know that life expectancy is increasing. And even at present, I've already mentioned 1.5 crores people are 80 plus. So 80 plus, 90 plus, I have seen, and my patients is there approaching 100. So these sort of patients, these sort of that lifespan after retirement, that is 60, that means it is nearly 25, 30 years, even more than 30 years. But we don't have any plan, definite plan how to live productive life in this last one third of the lifespan. Even not only individually, no plan, no planning from the community level, even in the society level also. So this is very important. How we live in the one third of the lifespan, last one third of the lifespan. And for the sustainable development of any nation, it is required for that productive life of even our elder population also. So we have to think very seriously. And thanks to HSSC for selecting this very important burning issue. Uh, Next, that actually geriatrics. What is geriatrics? Many people actually don't know about the geriatrics. Don't know means don't familiar. Geriatrics and gerontology. Gerontology is the entire study of entire elderly population in different aspects, like in the social aspects, economical aspects, financial aspects, other aspects, and including health. But geriatrics is only related with the health of the elderly people. And we are very much feel proud. We should be pretty proud that source of geriatrics is from the Ayurveda. And one of the eight branches of the traditional Indian system of medicine, that is Ayurveda. And in Ayurveda, two sections are there, two branches were there, that is Jara and Rasayan. And these are similar to geriatrics. That also reflected the conception of the geriatrics. And the term geriatrics, which comes from the Greek geron, meaning old man, and the iatros, meaning healer. And sometimes the geriatrics, which we call the medical gerontology. And some people think that the geron that comes from the that geron that comes from the what uh, um, that jora from jora that geriatrics what so this is about the Ayurveda source of. I am audible for everyone. Hello.
Yes.
Yes,
So
Dr. Ganesh, you're audible.
yes. Okay. Thank you. So the history of geriatrics. History of geriatrics, if we know that the geriatrics, the term proposed in 1909 by Dr. Ignaz Leonacher, who is considered as who is known as father of geriatrics in United States, requesting everyone to mute themselves. And modern geriatrics in the United Kingdom began with the mother of geriatrics, Dr. Marjorie Warren, and who is also known as the mother of geriatrics. So this is a brief idea about history of geriatrics. Then comes why geriatrics is a different subject, as geriatrics are also geriatric age group that we consider 60 and above in India. So this 60 and above in India geriatrics age group, these are what? These are adult. So why there is a difference, or why there is a necessity of this special field of geriatrics if even they are in the adult age group? There are different faculties and there are different fields are there in the medical field, like cardiology, like pulmonology, like neurology, gastroenterology, different neurology, that sort of things. So that sort of specialists are there. So why there is a necessity of geriatrics? Because there are some special points in the treatment or management of the geriatric patient or old age patient. So why that difference? First of all, in the geriatric age group, the mind and the body become more vulnerable compared to the other age group. So mind, what wrong meaning? The mind and the body uh, become more vulnerable in the geriatric age group. Number two, geriatric people, so the elderly people are suffering from multiple chronic illness. Chronic illness means which are sustained for prolonged time, even the lifelong. So chronic illness, like very familiar, the hypertension, the diabetes, that osteoarthritis, neurological some complication, like ischemic heart disease, like uh, chronic obstructive pulmonary diseases. Different diseases are there, even the constipation, so Parkinson, dementia. So different chronic illnesses are there in the geriatric age group. Usually, the younger adult age, the patients are suffering from maximum one or two or maximum three diseases. But in the geriatric age group, I have seen many of my patients are suffering from even seven, eight diseases. So these multiple chronic illness, and we have to manage these all diseases. So, and that aspect, some special points like if the multiple diseases, multiple complications, so obviously more complications are there compared to if one or two diseases. So that's a very important thing. Then another is atypical presentation. Geriatric patients are present with some atypical, not familiar complications, like in the urinary tract infection. They are just sometimes some patients may be just complaining of confusion. Or complaining of confusion, means the family members will think that a confusion is there, only confusion, or very low graded that temperature, or maybe irrelevant thoughts. That may be the primary symptoms of urinary tract infection in the geriatric age group. Even pneumonia can be manifested by just simple that as not sort of that high graded fever or respiratory distress initially. It may be just by confusion, just by irrelevant talk. That's the thing. So atypical presentation, we have to think that atypical presentation is there, and that is the special point of geriatrics. Then more psychosomatic than actual. The geriatric population, multiple the complete complaints are psychosomatic reason, not for the we call organic reason. So this is also very important part. Section of the health is a change, totally paradigm shift of that conception that every disease has two components. One has the a somatic component, that is the organic component, and another is a psychotic component. So every disease has two parts. But in the geriatric age group, psychotic part is more prevalent than the somatic part. Then there is a chances of drug interaction as because of multiple chronic illness. So geriatric patients should needs that multiple drugs, and that multiple drugs, the drug-drug interaction is there. Every drug has side effects, so adverse side effects are there. So more chances of drug interaction, more chances of adverse effects uh, due to medicine or medicinal cause. Then importance of preventive measures, as because the chronic illness are there. So chronic illness means very much required follow-up. And that follow-up means preventive aspects are very important. I have seen many patients who are follow up regularly with the doctors. They are more living more well-being. Their health are more better than those who are not follow up with the doctors. So this is very important. The preventive measures, chronic impairment of the body and mind, and if geriatric, it is irreversible that some changes will be there in our body. That is we call degenerative changes. And along with not only body, in the mind also the changes are there. So this manifestation will be there because of these degenerative changes of the body as well as mind. Then different geriatric syndromes, especially fall very important things. Then the geriatric people, they are not individually so much dependent, especially in the older age group. They are dependent on the caregivers. That caregivers may be the family member. That caregivers may be the professional. So caregivers involvement is very important in the geriatric treatment or management. Then it needs the rehabilitation, also very important part because of the post-stroke, because of the post-fracture, this sort of patient, even in the palliative, those needs palliative treatment, they need rehabilitation. So rehabilitation is a very important aspect. Another very, very important thing in the geriatric is it is not a single base any treatment or management. No physician is sufficient for treating any geriatric patient because it needs the team approach, team support. So this is a collaborative team approach is required in the geriatric management or geriatric treatment. So very important part. And not only we have to think these are these points, but important aspect is the socio-economic status. Because in our country, the majority portion of the elderly people are under BPL, below poverty line, belongs to BPL or low socioeconomic or marginalized people. So only the prescribing medicines is not sufficient for addressing the geriatric patient. And during prescribing medicines, as well as we should think how about the socioeconomic status of that patient. If he is able to buy the medicine, it is required. So just by prescribing, it is not possible to address the geriatric management or treatment. And there is a chances of hospitalization, obviously, because of the exacerbation of multiple diseases. So that chronic illnesses are there. So in that case, hospitalization is advisable, obviously. But because of the low immunity level of the geriatric age group, they are much more prone for the hospital-induced infection. And hospital-induced infections are very much notorious. They are bacteria, that viruses are very much notorious. So if no actual requirement is there, but for the other reason, we hospitalize the patient, that may lead to nosocomial infection, even that can lead to ventilation, even the death also. So we cannot advise or we should not advise any of the geriatric patient for the simple reason to hospitalize. So nosocomial infection is a very important one, and that needs a home-based care management part. That should be strong home-based care management. If it is there, we can avoid this sort of complication. And so that's emerging home-based treatment and care. So these are the points where the geriatrics are different from the other medical field. Then the discussion is, what is aging? Already, like I mentioned, aging is irreversible biological phenomenon. First of all, we should prepare our mind that aging is unavoidable. We cannot avoid by any means of aging. And obviously, progression of aging, we can reduce the rate that may be possible. We cannot avoid. So we should keep our mind, this is irreversible phenomenon. So we should adapt with that. That is very important. And who are aged? The persons above 60 years of age are classified as an aged person in our country. In Western country, mainly 65 plus are considered as a geriatric age group. So three major components of elderly health. Health, if you we define health in 1948, World Health Organization defined health as a state of physical, mental, and social well-being, not merely an absence of any disease or infirmity. But along with the physical, mental, and social aspect dimension, there are various other dimensions are also there, and now that becomes very important to address the health of an individual. That is spiritual health, intellectual health, these sort of components or dimensions are there. But in geriatric age group, if we like to address the complication of the geriatric age group, that geriatric age group, geriatric problems we classified into three parts. One is due to aging process. I have mentioned it is because of the degenerative changes of our body and system. Number two, that problem associated with long-term illness. Long-term illness is mainly related with the treatment of chronic ailments. These are sustained for many long years. So that long-term illness, that's related cause. And third one is the psychological problem. Very, very important. Another I would like to mention is the social problem. It is also very important part. And we have to think about the social problem of the elderly if we like to address or if we like to give the quality age of the geriatric age group. So this is very important. So what are the health issues of elderly because of the aging? For as we know that our first of all, if we think simply that our sensory organs are affected because of the degenerative changes. And sensory organ means our vision because of the senile cataract. Then hearing, then touch, then even touch, temperature, feeling, sensation, that sort of things. Then even our taste, even our smell, that all are affected because of the degenerative changes. But it is not that every geriatric age patient will be suffering from that sort of things. Maybe, maybe that's tailor-made. Even at the age of 90, that patient, that person may be completely okay, but even at the age of 60 may not be okay. So tailor-made their complications are there. That's why we have to think that aspect also. So that senile cataract, glaucoma, nerve deafness, like osteoporosis, the emphysema, the lung problem, the expansion of the lung, the alveoli are not properly functioning, alveoli, which are balloon-like structure, unit of our lungs. Then failure of the special senses, I have mentioned already, and changes of the mental outlook. These are the geriatric health problems, which are commonly because of the due to aging. Then geriatric because of the long-term illness. I have mentioned about long-term illness. The degenerative diseases of heart and blood vessels that may cause the ischemic heart disease, that may increases the chances of heart attack in geriatric age group. Another is the cancer. We should not be panicked. But cancer, the chances are there. Accidental injuries are common. That is another very important thing. Diseases of our locomotor system movement, that's why affected. Respiratory illness are there. Geriatric patients are suffering from COPD sort of. Many of the geriatric members who have now attending today, they are suffering from respiratory illness like COPD. Then genital urinary system, the urinary holding of the urine, the incontinence of the urine, these are the very common problem in the geriatric age group. And that's there because of the long-term illness. Then the gender variations are there. There are gender variations in male. Obviously, because of the presence of prostate, the males are suffering from benign prostatic hypertrophy. Benign means these are not malignant or cancers, but there are the chances of prostatic cancer also. Even the female and the microceles, these are also there chances are there. Then in female, the breast tumor is not all tumors of the breast are not malignant. So breast tumor may be the benign breast tumor. Majority are benign, so don't panic. That should be cautious because that demarcation is very important. Is it benign or is it cancerous? So that should be obviously judged by the doctors. So CA breast, carcinoma of the breast, uterine in India, breast cancer is the second most common cancer in the female. Even globally, that is the first common cause. In India, the first common cause of the cancer is your cervical cancer, but breast cancer is the second one. But in the geriatric age group also, the patients are suffering from the breast cancer. But if diagnosed early, then it is totally curable. So don't panic. So we should be cautious. That's the important thing. Then uterine fibroid, the prolapse of uterus, then the ovarian cyst, even the CA of ovary, CA of cervix, uterus, and the very important thing, the menopause. After usually 45 to 55 years is the range of menopause. That means cessation of the menstrual cycle. So after menstrual cycle, there is a massive changes of the hormonal imbalance are there, and because of that, many physical changes will be there in the menopause and perimenopausal age group. So that's also very important and that should be addressed. And hormonal replacement therapy, sometimes we advise, but it should be under the, obviously, it is the discrimination of the doctors because everyone is not better or not possible in everyone, every female. HRT is not possible because of the various reasons. So that is the gender variations. Then mental health issues of elderly. This is very important issues, but most overlooked issue. And the people are not aware in the not only in the rural sector, even in the urban sector, even in the very affluent society, people are not aware about the mental health issues. So it is a very important issues. Whenever your any parents or whenever any geriatric age group, any elderly people, they are suffering in the issues of decision making. They are suffering from hallucination. Not actually they are, but they are thinking. So delusion, that sort of thing. Always anxious. That is no actual reason. Concerns with memory. They are isolated. They are avoiding social or family gathering. We should not overlook these things. It may be the symptoms of depression. And if that depression is not diagnosed in the proper time, it leads to severe depression and even leads to the suicidal tendency, suicidal attempts. So this is our responsibility, the family member's responsibility, community member responsibility, and to address, to know about the mental health issues of elderly. Then social health, I have already mentioned. I emphasize always as a social activist, as a geriatrician. Social health, social isolation, loneliness is very much common in the geriatric age group. And older adults have increased risk of loneliness due to the loss of loved ones in the later age, loved ones due to family member, their wife, spouse. So that in that cases, loneliness is there. Disability or worsening of the quality of life and lack of access of transportation. They are not able to go to the friend's home. They are not able to go to their relative because only because of the lack of transportation, lack of accompanying person. That leads to loneliness, isolation, and that is a very much bonding issue nowadays. And it is proved that loneliness can increase the risk of heart disease, increase the risk of dementia, stroke, anxiety, and depression. So, and if we think another way, if we enhance the social health, social connections can increase the longevity and improve the emotional and physical health. So it is not only the responsibility of the individual elder person, it is the responsibility of the family, it is the responsibility of the entire community, irrespective of age. We have to think how to give, how to provide the social well-being of the elderly. So this is very important thing. Next one, that is in the abuse, the time to act is now. That many of our geriatric people, not only in the metropolitan city, not only in the urban area, but even I have seen in the rural area, they are suffering from different sorts of abuse. So what is the elder abuse? There are different types of elder abuse, physical abuse, which can range from the slapping, from the hearts, from beating, that sort of things. The psychological abuse, it is very important thing, psychological abuse, just by uttering unacceptable language. So silent treatment, and this is very important that that soft abuse, this is known as soft abuse. This soft abuse is very important nowadays in the geriatric age group, and they are suffering from this sort of soft abuse even from their family members. So we have to think soft abuse has no evidence. So they cannot prove it because every household there is a no your CCTV, and it is not acceptable and desirable also. So these points are very important. Soft abuse. So that's required. What sensitization of our younger, even the child, about their how they behave with their senior. So this is very important. Intentionally, there is another negligence, that negligence from the physical, social, emotional, and another is the financial abuse. I've already mentioned in my last slide or second slide that our elderly people they are dependent on a majority of our elderly people are dependent on others in the financial aspect. So this financial abuse is also there. If we like to address the geriatric patient, elderly as patient, we have to think, we have to assess. This is a comprehensive assessment. I always mention the geriatric management, geriatric treatment, it is not a chamber-based treatment. It is not a 15-minute, 30 minutes treatment. It's required long time association with with that patient. So that's needs, and another very important thing is a comprehensive assessment, not in one single point. It should be assessed by medical, it should be assessed by psychological aspect, social and environmental aspect, even the functional aspect. So if we assess in these all points, then only we can assess completely in the geriatric age patient. So this is important. Next one, what medical points? First of all, comorbidities. Are there or not? Their continence, their urinary holding power is there or not? This sort of continence is there or not? Chances of fall is there or not? Chances of fall because of the physical cause. And they are categorized two types of fall rates. One is intrinsic. Intrinsic means this because of the body cause, like different disease, their muscle weakness, neurological cause. These are body intrinsic. But extrinsic factors are also there. Only because of the home is not friendly, and home because of the furniture, because of the improper toilet, improper washroom, improper bedroom, the chances of falls are there. So we have to think that, we have to modify that. So that is also very important. Then very important nutritional status. We overlook sometimes nutritional status, but it is very much important, very important with that medication, because if nutrition is suppressed, then we cannot achieve the outcome of the patient's like treatment. So nutritional status, that is important. Medication, advanced care. Some patients need palliative patients, post-stroke patients, bedridden patients. They need advanced care. So we have to think, we have to plan it. Advanced care. Their vision and hearing. These are also the medical side. Functional side. Their gait, their movement, their balance, mobility. Their basic activities of daily living, like feeding, washing, toileting, that sort of things are properly there or not. Another one is the instrumental activities of daily living. They are able to shopping, cooking, not in the older age group, but in the 70 plus, even in the 80 plus, they should have it. But that is there is not. They are maintenance or not. They are writing, reading, that sort of things are actually there or not. I have seen many of my patients who are approaching 90, they are so much sound intellectually that we are not also that sort of sound. So that sort of patient, that sort of geriatric members are also there. But advanced activities are usually less if they are not properly, family members are not concerned. Even the individual may not be concerned about that. So these hobbies are very important in the to life, to live productive and miserable life in their second years. This is very important. Then the comprehensive psychological already mentioned mood, cognition, that sort of thing. Social, I already mentioned that. I should not go details. So simple assessment. Let's see, at least for doctors, but if any intellectual person can assess this ADL, that means activity of daily living, independent, moderate impairment, or very much dependent. That's another is the IADL, instrumental activity of daily living. It is able or needs assistance or not able or unable. Cognitive, their cognitive, their thinking, their cognition is there. How much status? What is the no cognition, no cognitive impairment. Then maybe subjective, maybe mild, but dementia is there. But this should be judged by doctors, pediatrician, doctors, house physician, any general physician even that if he or she can assess this very simple assessment process. But my point is family member also should be aware about that. If anything that cognition level there is impairment, we have a thing that this is going on. Don't waste time. Consult the doctor. This is very important. Consultation, initial consultation, and the consultation at a proper time. If that is there, we can address very simple way. We can we can arrest the progression. So it is very important to diagnose it in the proper time. Then, important in the geriatric age group is the periodic geriatric assessment. As already I mentioned, the geriatric people are suffering from multiple chronic diseases. So that chronic diseases, if these are parameters are properly going on or not, BP is proper, normal or not, the pulse rate is normal or not, respiratory rate is normal or not, that sugar is level is maintaining or not, thyroid level is maintaining or not, these should be properly checked in regular intervals. So that needs periodic geriatric assessment. If you ask me individually, I would like to advise that periodic assessment, if chronic multiple ailments are there, if geriatric age patients are there, every month I advise to follow. But if it is not possible, at least once in 3 months, or at least if not possible, twice in a 6 months. once in a 6 months. So that follow-up is very important. And that follow-up means prevention. I have seen in preventive aspect, when we check preventive checkup for the member, we diagnose some complication at early age, in early stage. Even we have diagnosed prostatic cancer in the early age and totally cured. So breast cancer in the early stage, totally cured. So that is a very positive point of follow-up. So follow-up is very, very important in the geriatric age group. Then medication, very much the matter of concern in the geriatric age group. First of all, without doctor's advice, no addition, no subtraction, no alteration, no timing change, no stoppage. Should not do it with yourself. Sometimes that practices is there, suffering from any loose motion. Previous one prescription, doctor advised that medication. We have started that. Is it so simple? So if it is that sort of things are there, if we know the 50 medicines, then treatment is possible. So why this long time that education is required? So this is not simple thing. So without doctor's advice, this we should uh, keep our mind that no addition, no subtraction, no alteration, no timing changes, and no stop. Another very important issue is the polypharmacy. Polypharmacy means multiple drugs, sometimes unnecessary drugs, not required at all. But polypharmacy, the geriatric patients are suffering from very much prone, they are suffering that from polypharmacy. As per definition, five or more than five drugs, if we have taken in the same year, they are that means polypharmacy. But as per definition, the 80%, more than 80% geriatric patient will be under that polypharmacy. It is not rational because some patients are suffering from multiple diseases that may need to take multiple medications. But that should be advised by the doctor, and doctor also should think the polypharmacy is going on or not, because polypharmacy means drug interaction, drug adverse effects that leads to multiple complications, not only physical, even the mental complications. So we have to think it. And whenever actually polypharmacy sometimes even generated from the patients. Patient nowadays the practice is they are not going to the general physician. For one simple reason, they go to the super specialist doctor. I'm not against that. But every doctors, they are complaining some complications, same thing, gaseous complication, flatulence, constipation, and multiple doctors advising multiple drugs for that same reason, and they are taking without knowing. So that is the one of the cause of the polypharmacy. So we should be much more cautious. Even the doctors are also much more cautious about the medication. So medication is the very important issue. Then is the most important I already mentioned, so I should not go. This is very simple thing. Everyone should know and everyone should play important role on that. Aware, aware if any bowel irregularity, that off and on constipation, loose motion going on, severe constipation going on. We usually term constipation very simply, but constipation not so easy. Constipation, our normal bowel habit is one thrice in a day, two thrice in a week. So if anyone's stool passing three times in a day, don't worry. Even three times in a week, that is the normal bowel habit. If that is not there, then constipation. So bowel irregularity is there. Off and on loose motion is going on. Don't ignore it. Consult with the doctor. At least inform the doctor. Bladder irregularity, urinary irregularity is going on. There is any bleeding from the any side, even nose. That may not be the nose cause, maybe the hypertension. So that is very important. Any alteration of the consciousness level. So suddenly, you have seen that your father, mother is some confusion is going on. Consciousness level is not well. Don't overlook. Consult doctor. Maybe simple reason of the electrolyte imbalance. Maybe brain-related cause. So that requires diagnosis and proper diagnosis in the proper time. breathing irregularity is going on, cognition level is not proper, and mood abnormality, behavior. That's very important. This is very much overlooked part, but very important. Usually, depression is not started severely from initial stage. It gives some signs, but family members overlook that. That's why depression leads to severe depression, and that causes mental retardation severe. So, we should not wait for that. So, we should think about it. And in this aspect, one and another important, we are very much concerned about the dementia. We are very much nowadays familiar with the term dementia, familiar with the term Alzheimer's. We should think first of all that we should not be panicked. In a military issue, some of the memory loss will be there because of the degenerative changes. But we have not think in otherwise also that it is only because of the degenerative changes this memory impairment is going on. So every memory impairment is not dementia Alzheimer's, but every memory impairment is also not from the degenerative change. So for that demarcation, this is very important to consult with your just house doctor, home doctor, geriatrician. It's not required first just go to the neurologist. Appointment is not available. Waiting for 6 months, not required. Just tell your doctor, he or she will determine that is it because of the age related or is it the signs of the dementia. So that sort of things. And you know that Alzheimer's is the most common cause of dementia. And one very important message is dementia is usually what happens when the activity of daily living is hampered. The person is not oriented about place, about time, about the past. He will not recognize his environment. So this is really. If activity of daily living, normal brushing, doing, eating, these sort of things are not properly there. That means this is not a simple memory thing, memory related causes, maybe the dementia. And if you overlook that, it becomes more worse, then it is not possible to arrest the progression. Actually, dementia, no treatment is available, no curable treatment is available, but we can reduce the progression. So that's why this is important thing for the initial diagnosis. Then it is very important another thing. We are overlooking this sort of thing. Healthy and balanced diet in geriatric age group. One called the balanced diet. Every components are required. It is not that we only take the carbohydrate, we only take protein, we only take usually fats are not taking. This is not adequate. Every component, every micro components are required. Avoid high glycemic index food and fruits. Those foods which are high glycemic index. How we will know that? Simple thing, you go to the Google, they are high glycemic index foods are there like white bread. That is a high glycemic index food. Our watermelon, high white glycemic index food. That sort of things are high. Any sugar, any simple sugar, high glycemic index food. So that's sort of grapes, high glycemic index food. So we should avoid. Number three is adequate fluid. Adequate fluid is very important. Here, fluid is mentioned, not water. Water is the major part of the fluid. But fluid means our tea, tea, any beverages, these are all are in the fluid. But adequate fluid means we should not take much more, we should not take much less. Because if we take much more, it is not that much more water intake is permeable. No, in the geriatric age group, it is not permeable. Because if we take much more amount of water, that can lead to heart failure or chances of heart failure. So that is the very important thing. So that should be obviously if chronic ailments are there. The usually doctors advise how much we should take the fluid balance. But first of all, we should think fluid does not means only water. Fluid means any sort of fluid media. That means even our coffee, tea, any beverages, that's even the soup, any dal soup, that sort of thing, all are under fluid. So that is very important. Our some of our elder peoples, because of the social reason, they are dependent on the free stored food, but we should avoid. Family members should keep in this mind that free stored food is not desirable for They should avoid processed food. They should avoid repeated boiling and cooking food. So this is also very important. Then possibly preserving food, contamination of food, maintain the timing of food. This is also very important. Many of our elderly members are not maintaining their timing of food, and that's why the gastrointestinal different complications are arises. So maintenance of the timing of food is also very important, and if required, we should not hesitate to take any nutritional supplement, but we should not take it just by saying the advertisement. So this is also very, very important thing. Then another very important thing, thanks, madam, for appreciation. Prevention is better than cure. And this is very much applicable in the elder age group also. Because immunization has very important role in the elder age group. And in immunization, three immunization is very important. Every year, influenza immunization. Number two is the pneumonia and pneumococcal. And after 65 years of age, usually two strain. First, we have to take PCV, then PPSV 23. This is a very technical term, but you, if not given or not received yet, consult with the doctor for this pneumonia vaccination. Only two vaccine, two strain PCV 13. Then after 1 year PPSV 23. Then total no requirement to take for further. So one time, tetanus every 5 years, 10 years, 5 years. We have to take tetanus if major any injuries there. Then the prevention of osteoporosis prevention, calcium and vitamin D supplementation, very important. But we should not take abruptly calcium. It has also adverse effect. So that should be advised by the doctor. And if vitamin D is low, it is no effect of the taking calcium, because calcium absorption is totally dependent on the vitamin D. So if vitamin D and we are not supplement that, and we are taking calcium regularly, no effect will be there. So this is also very important. Some protector devices are there, heat protector devices are there. If you need, that should be, that is also required. Another very important thing, oral, healthy oral. Because we are overlooking that in the geriatric age group, especially in age group. So proper brushing, oral hygiene, we have to think any discharge is there, we have to see any discharge is there, any bleeding, any smell, any taste variation, any sort of pain, any growth. So this sort of thing, if they are, we should consult with the doctor, dentist. And I advise you, in every elderly individual should consult doctor, dentist at least once in a year, at least once in a year. And another, we should not be heroic attitude should not be there, and we should not open anything by just using our teeth. So don't utilize your teeth to open anything. And so that is also very important. Then for physically fit, not need to go gym. It's not required. Don't think over. Don't think that is complicated thing. Think simply. In geriatric, this sort of just simple exercises can lead to the productive life. Knee to chest, that ankle palms, wrist stretching, neck stretching, shoulder flexion. Very simple thing. Don't do any complicated exercise without doctor's advice. That will be detrimental for your health. So, not need to go gym, take it easily, take simple exercise, do simple exercises. So this is very important. Then it is a very important thing, elderly friendly home. Geriatric people are much more prone for the falls. And that already mentioned experiencing factors, because of the home is not friendly. The room is not friendly. So elderly friendly home, that should be well ventilated, Minimum furniture should be there in the elders' room, well lighted, broad entry and exit, floor preferably no marble, no carpet, toilet commode system should be there, handle in the two sides because geriatric patients they are suffering from usually the hearts too, constipation, long time sitting is required. But whenever long time sitting after standing, there is a relieving of head, orthostatic hypotension, the pressure become low, and that needs to fall. So that can be prevented by just this holding in the two sides. So that's also very important. Bedroom only for sleep, no other purpose. Preferably if two-story building, three-story building is there. Preferably the elderly people should be in the ground floor, and the staircase and spacious lift should be important aspect. Then earlier I had mentioned that it is a team of holistic collaborative approach. No individual, no single physician that he may be the very super specialty, very renowned doctor, but he or she is not at all able to address the geriatric population if the team or collaborative approach will not be there. So that's why the family member, even the relatives, friends, neighbors, healthcare team, healthcare other professional like physiotherapists, yoga, movement therapies, that's swallow therapy, even the psychological counselors, caregivers, everyone should be the member of that collaborative approach. And every person has importance, same important, not the doctor only. So that's why collaborative approach is very much required. If we like to address actual complication of the geriatric patient in holistic way. So that's why it's a very important the team in holistic collaborative approach. Then another is integrated approach. Our geriatric people, elderly people, they are much more familiar with the Ayurvedic medication, like natural medication, naturally available. I'm not against at all, but Ayurvedic preparation, homeopathy, whatever, you may take that. No ego should be there in the modern medicine practicing doctor. But that should be also advised by the doctors, by the qualified doctors of that field. It should not be by just seeing the advertisement because sometimes even the Ayurvedic medicine in advertisement these are there, but actually the steroid components are there. So when you so if you like to take the another alternative therapies medicine, you should take, and that should be by the doctor's consultation. And you should always mention that to your physician, modern medicine physician, as well as if many modern medicines that we are taking, that should be also informed to the other homeopathy Ayurvedic doctors because it's integrated approach. And in countries like India, where the socioeconomic standard is so not proper, in that aspect, if we like to address the geriatric people, especially the marginalized people, especially the rural people, we have to give emphasis on the integrated approach. Not only depend on the modern medicine, but unfortunately, modern medicines price are more compared to the other medicine. So we have to think on that aspect also. I don't have any obligation or any objection any thing for this integrated approach. Rather, I always emphasize, I promote that integrated approach of therapy in the geriatric age group. So this is important. So ultimately, my point of discussion is providing geriatric care is not an easy matter at all. So it requires healthy blending of updated and skilled professionalism, dedication, and the most important is the dignified predisposition towards the elderly. So this is very important thing. Then it is our organization. I already mentioned in my that initial point that it's my experience-based knowledge I'm sharing today. So our organization is a first Eastern India's home-based geriatric healthcare support started in the 2007 when that sort of conception was not there. But obviously home-based conception was from our ancient time, but that a modernized conception was not there. Now at present 1600 enrolled members and more than 550 active members are there, and many of our members are leading so quality life even at the age of 90, 85. So we are wondering actually. So we are blessed with their support, we are blessing, and that is the key point of our success. So our ultimate motto, the changing of this, and in the picture along the two sides of my ourselves, one is 90 years, Mr. Shannon Dasgupta, and his wife, Mrs. Minakshi Dasgupta, 81. And I am saying I am their doctor for 20 years. And in front of my eye, there are changes from the younger age, older age group to the older age group. So changing in the 20 years, every month I visited them at home. So I know their health status in my farm. Okay, and that's why this is very important, long-lasting relationship. I know which changes are actual changes, which complications are actual complications, which complications are only anxiety-induced complication. So we should think it. And fortunately, the Chamal Babu, that 91, 90 years now, he was suffering from the corona period. He overcome that with our support, and his mental power is so powerful. Always I hats off to his mental power. How he overcome that corona, severe corona. He needs 5 to 6 oxygen cylinders in a single day in that corona period. So, but he overcome that. And not only overcome, at this age, this complication, I took that corona vaccine in the community health center, obviously with our support. So that uh, orientation, that urge, that is also there in Chama government. So that's our motto, changing our geriatric age, not in the confined way, but in the broader way, where we should love them, we should respect them, because that they need dignity, not our sympathy. Empathy is more important than sympathy, and dignity is more important. So thank you very much. Hello.
Thank you so much, Dr. Dhires. That was very informative session, and I hope our audience has got a great insights, and they would be able to do a better geriatric care for their own family members as well as to the vicinity, to the patients they are attending. Thank you so much.
Thank you. Thank you.
If anyone have any questions to ask, so please post the questions on your chat box. Meanwhile, Dr. Dhires, we are having some questions with us. Um, in case of quality care giving to the elderly, what points should be kept in mind as a caregiver, as a doctor, if any family member wants to become a caregiver? So how what points they should keep in their mind?
Thank you for a very important question. So, if as a member of a team of their caregiving aspect or treatment aspect, from the doctors to caregivers, and even the family members, even the individual himself or herself, first thing is obviously we should aware the physical changes, we should avoid the mental changes, and what needs are required. First of all, the physical changes, because I have already mentioned that people are suffering, geriatric people are suffering from the complicated or multiple comorbidities. So that's these comorbidities, whatever the diseases are there, the parameters are maintaining or not. So that is very important. Any simple changes, whatever we think that is not normal, even the discoloration of the skin, any appearance, any appearance of rashes, any sort of changes in the bowel movement, any sort of changes in the urinal point of view, we should not overlook. And but we should not be panicked also. That is very important. First thing is to know that. And after knowing that, we should convey that to the treating doctor at a proper time. If that proper time we can convey, then the treatment is very easy, and treatment not only for the medical aspect, but for the economical aspect also. If that anything is diagnosed initially, the medical cost is also affordable, low. So that's why it's very important. Another thing, how to behave with that person as a family member, as a caregiver, as a doctor. As I mentioned, I am geriatrician. My practice is not based on the chamber. It is practicing like just like a picture showing at the home. The long-lasting relationship. They don't think that doctor is coming to check their status. They always think their family members, close member is coming to check his or her. So that affectionate connection is very, very important. And that gives the dependency and reliability. And reliability is very important in the geriatric aspect. If the patient is reliable to me, if the patient is reliable to the caregiver, that outlook or whatever the outcome is very productive. So that is very important. So dignity, we have to maintain the dignity, and not only the dignity to movable patient. Even if we are engaged in treatment or care of any bedridden patient or unconscious patient, semi-conscious patient, we have to keep in mind that dignity should be properly maintained. I have seen, unfortunately, in many cases, even in the hospital, don't bother about the dignity, minimum dignity of that patient. They say, okay, what unconscious patient, what will happen? No, that six senses are there. They are think that they in brain or in unconscious mind that is going on. Dignity is properly given to him or her. So that dignity is a very important aspect in the geriatrics. So the dedication, professionalism, skill, knowledge. These are the very important components of geriatric care. Hello.
Thank you so much, Dr. Dhires. And people are also mentioning that upgradation or training of caregivers will help to assess the problem for geriatric care and to resolve the
Yeah.
problem.
Yes,
So,
actually, HSSC is going on their different courses of
right.
that. So that's
So we want to inform to all of you that HSSC is having the national qualifications on geriatric caregiver for institutional as well as home care, as well as we have one more qualification on geriatric care assistant. These two
yes,
qualifications are being enablers for the better training aspects of the geriatric caregivers who can give better care to the geriatrics. They are also getting posted into the home care settings, hospital settings, the old age homes, and very happy to share this is the program which we are also in the talking terms with the other countries. They also want these kind of geriatric caregivers from India to be sourced there. So that is something very useful program. In this, my colleague, another colleague is having one question. So I'm handing over to her to ask her question.
Dr. Dhires, thank you so much. Yeah, I just want to ask one thing that we have so many elders who are taking medications in different modes, like they take modern medication and homeopathy together, or Ayurvedic medicines together at the same time they are taking by themselves. So is it advisable, or does it cause any harmful effects if they do it?
I have mentioned in a brief in my presentation that obviously we should emphasize on the integrated approach. And I have seen the geriatric patients are most familiar to take the what we call the natural medication, that Ayurvedic medication, leaves, that sort of things, naturally available things. They are very much familiar, they are comfortable with that. But we should not ignore that point. Rather, we should give emphasis on that point. But what is going on that many of our geriatric patients or the geriatric age group, or even the family member, they are very much influenced by the advertisement, whatever is going on in different channels, radios, TVs, and that sort of things. And they are taking with that advice that constipation, okay, this sort of medication they are taking, Ayurvedic medication or whatever that. So we should not take that. It is not advised. Not because we are not ignoring that alternative therapy management. No, because every medicine is based also. Another one thing that modern medicine, yes, the drug-drug interactions chances are more common. Rather, obviously, Ayurvedic medications or natural medication that may be less, but less percentage is there. And we don't know the composition of the drug medicines, and maybe affect the interaction with the modern medicine, whatever is taking for in other reason. So that's if we are familiar, if we comfort with that, or if we choose that, don't hidden that point to the doctors. Rather, you inform them that sort of medicines, Ayurvedic medicine we are taking, that sort of homeopathy medicine we are taking, and along with the modern medicines that we are taking. Obviously, in integrated approach, if we take from the proper doctor, qualified doctor, I think no hamper, nothing will be there because they know what medication should require to give and what may be the chances. If any chances are there, they should allow the patient what symptoms and signs they should look for that, any changes and inform the doctor. So that guidance will be there. Otherwise, without any guidance, without any advocacy, we should not take any, not only the Ayurvedic, not only homeopathy, not only the other medication, even the practices are there. We are taking antibiotics. One day just sneezing, one day just suffering from fever, taking antibiotic. Irrational uses of antibiotic nowadays become very emerging and burning issue of the treatment, not only in the geriatric but even entire issue. So we should not take it because or diseases, antibiotic has no role. Antibiotic role, there's specific antibiotic role in specific disease. That could be by doctors. And even the normal practicing of the common people, they don't completed the course. Yeah, after taking 2-3 medication, that complications arrested, they think okay, so they stop there, but that leads to what? That leads to antibiotic resistance. And if we take antibiotic rational, it's not only affect individual health, it is more affecting the community health. You are hampering the community health. So you don't have that, don't do that because you are a responsible member of community. So we have to think how to protect our community here. Okay, so that's why this is very important. My always advice is take it any medicine, but with doctor's advice.
Thank you so much, Dr. Dhires. One last question from our side. If you have mentioned that follow-up is very much important in geriatric treatment, how frequently we should follow up with our doctor?
Yes, I have mentioned follow-up is very important, and I have already mentioned it on the slide also. Usually, if geriatric people, all geriatric people are not suffering from multiple diseases. Even I have seen 70 plus, 80 plus people, they don't have any disease. That is also there. But even the 60 plus patients, elderly people suffering from 5 to 6 diseases. So chronic ailments, whatever is there, hypertension, the ischemic heart disease, the gastric problem, the movement problem, osteoarthritis, okay, hypothyroid, thyroid complication. So that sort of things. So these all complication needs medication. So that medication is obviously depends on the parameters of that. We don't abruptly take any oral hypoglycemic medication, and that means drugs for the lowering of blood sugar level. Because that depends on how much my sugar level is going on. Not only the sugar fasting or BP, it's required to check HbA1c, okay, glycosylated hemoglobin level. Usually, it is three months, every 3 months we have to check, but it is costly. So at least twice in a year we have to check HbA1c level. So this is going on or not. Sugar level fasting or PP always don't reflect the actual thing. So that for that reason, the HbA1c level is required. My some of the patients are taking long time for the thyroid anti-thyroid medication, and they don't know the dose modification is required. Thyroid anti-thyroid, whatever thyroxine, this is not a drug at all. This is hormonal supplement. So after taking without doctor's advice or without the parameter, what level they are taking for hypothyroid, and ultimately they goes to hyperthyroid. I have seen many patients. So that's this follow-up is very important, especially in the geriatric age group. And that follow-up, I will always prefer, I already mentioned, that if multiple chronic ailments are there in the geriatric age group, especially in the older age group, they should follow up with the doctor every month. Very disturbing. Every month, they should follow up with the doctor. Not to know what is going on, what happened, but to know that his or her health is absolutely fine. That's all. That message from the treating doctor is also very important. It gives mental booster to that, okay, I am fine. So that feelings, that is also very important. So that for quality life, it is very important to follow up with the treating doctor, if possible every month, but if not possible, at least once in a 3 months, those who are suffering from multiple complications.
Thank you so much, Dr. Dhires. With this, I just request you to please stop share the screen so that we can also see the audience while they would be actually now is the time they have to participate, because this session was not the only one, this session that the speaker is speaking and you are only listening. Now we are going to test little bit that what all you have learned from the session. So we are opening the poll. But before that, Dr. Hayes, I just request you to stop sharing your screen.
This is, I'm not able to do that, but how can I stop that? Here, multiple participants can share. You can share also. I think you can also share that.
Right. So we have opened the poll, sir, to everyone. Please go through the questions, answer the same, and you would receive the good answers for the same. We will test that how good or bad answers you have given. And please speed up, everyone. Give the answers. There are 5 questions with a multiple choice. Let's see that how much you have understood, and if you haven't understood, you will get that what actually is the answer for these questions.
मैडम इससे क्या मिलेगा?
This is the last call for the poll to answer. We are going to close it in another 30 seconds. Please be fast. So we are ending the poll here.
এই অপূর্ব এটাকে একটু বন্ধ করে দাও তো আমার
Please mute yourself.
এটাকে একটু বন্ধ করে দাও তো
So the poll answers are there with us. The first question was, in India, geriatric age group is considered as, and there were 3 options. Most people have answered 60 years and beyond. Dr. Thérèse, is that the right answer?
Yes, 60 years and above. In other countries, Western countries, they are considered 65 and above. But in India, the geriatric age group is considered as 60 years and beyond that.
The second question was, memory impairment in geriatric age group is. Most of the people have answered as because of age. Is that the right answer? The other options were because of dementia that should be assessed by the treating doctor. But the most people have answered because of age. Dr. Dhires?
No, geriatric impairment, memory impairment in geriatric age group. Actual answer is it should be judged by the doctor, treating doctor, because it may be the age related or it may be because of the dementia. So differentiation is very important. So it should be judged, assessed by the doctors to what is the cause. Obviously, common cause is the obviously age related, but the answer, proper answer should be judged by doctor.
Thank you so much. I think so audience are now getting that what was the right thing we all have understood. Thank you so much. In geriatric age group, food and water. The most people have answered follow the advice of undercare physicians and along with dietitian suggestion if possible. Is the right answer?
Yes, yes, yes. Because geriatric age group, we cannot liberally allow to take food and fluid, and we cannot even restrict without unnecessary cause. So, what amount of, especially in the fluid, and what type of food is required, that should be by always advice from the doctors, treating doctors, and
মোটে বন্ধ করতে পারছিস না
nutritionists.
কি
Great.
কথা আসছিল কি
So
সমস্যা
bed sore, next question was the bed sore can be prevented by. So there were multiple options. The most people have clicked the all of the above mentioned points. The points were by keeping bed clear, by using an air mattress, postural changes at regular interval, early consultation with doctor if any possible changes. I think so, Dr. Thérèse, was the correct answer. All the above points.
All the above, obviously, because bed sores that can be because of the not properly keeping bed, especially if unclean and the bed cover is not properly there, so that leads to compression, pressure, and that can be and usually if the chances are there when prolonged bedridden patient, post stroke, post traumatic fracture, and that even the debilitating patient, in that case we can avoid if we use air mattress. Postural changes is very important. One only postural changes, at least in the daytime, to avoid direct compression. And early consultation, some changes if there is going on, like reddishness, blackishness, or the breaking of skin contact intactness. If that sort of things is going on, consult doctor. Initially, if we consult doctor, easy treatment. So
Right.
all the above mentioned points are
Correct.
correct.
Thank you so much. If needed or we think prescribed medicines for our elders. Most people have answered we can't do anything without under care or concerned doctor's advice. I think so that is very, very true. The prescribed medicines should be we should
Yes.
follow what the doctors only on the
Yes.
doctor's advice that
Yes.
he has cleared multiple times. Thank you so
Yes.
much
Thank you.
for
Thank you.
everyone to Thank you so much for everyone to participate in this particular poll. Most of the people have answered the questions. More than 80% have participated in this poll. This was the great audience. Thank you very, very much. This is the connect of HSSC. People were asking where we can connect with us. So the email IDs of me, my team members are given. The website address is given. Facebook, Instagram, and LinkedIn links are given to all of you. Please take the snapshot of the same and do connect with us if you have any queries, if you want to join the course, if you want to start the course, if you want to meet Dr. Dhires, then also you could write to us. We would connect you with him. So you can always connect back to us. Next slide, please. Next slide, please. So this is the next webinar we are having on 29th of July. We are just putting it on the screen. You can scan and register yourself for the next webinar, which is on 29th July. This is on a very interesting topic by Dr. Karuna Nagarajan, who is the founder of Swarva Veda. She is practicing in the music therapy, which is the topic is the music, mantras, and yoga for pregnancy and easy birthing. So especially for the ladies and also the men for their own wives. And also all the healthcare professionals, they should know that how the music, mantras and yoga can help during pregnancy and during the birth process. So please do join this webinar. Scan and register yourself on the screen. In any case, we are also going to send this webinar particular brochure to all of your registered email IDs with us. That was a lovely audience. Thank you so much. Dr. Dhires, thank you very, very much for this lovely insights, very valuable insights. I really got many insights, even as a healthcare professional, we also miss many points while we are doing the care for especially our parents. So thank you very, very much. That was very helpful. So we are ending the session. Everybody could log off. Thank you so much.
Thank you, thank you. It's my privilege and honor. And thanks to every participants, those who are seniors, pranam, and those are my age group or younger. My best wishes, and everyone, those are attending today's some senior members, even from the police community. Police community means police community wing. The pranam members also join. So my regards and gratitude to HSSC for giving this prestigious opportunity. Thanks. Thanks.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you. Thank you.
Thank you, sir.
Thank you.
Thank you, sir. Thank you.
Thank you. Thank you.
Thank you, sir.
Sir,
Thank you, sir.
Thank you, sir.
Thank you. Thank you, everyone.